I'll introduce everyone. One colleague was not able to make it, but wonderful that everyone is here. So I will join you here. Okay, thank you. And we are, so I said around 1:15. We may end up being 1:30. You'll forgive me. But hopefully this will be worth it, and I'm certain it will. So we're really thrilled. This will be our last panel, and then afterwards, I'm just going to give a very, very brief what we're planning post-commission. So let me introduce the colleagues, and then we'll jump right in. It'll be a similar sort of format. So we have Hanin Ahmed, is a Sudanese activist and emergency response room leader. She helped organize community-led aid in Sudan, including food, medicine, protection, GPV support, and evacuation services. Hanin also kindly wrote a commentary that was published alongside the Commission report on Sudan's ERRs, which I think many of us see as an incredibly important example of how localization can actually occur. We have Jeremy Konyndyk, who's the president of Refugees International. He's a former senior USAID official with extensive experience leading humanitarian response, disaster assistance, and global humanitarian emergency programs. And Jeremy was also on our advisory committee. We had, unfortunately, Ella Watson-Stryker from MSF was supposed to join us, but unfortunately had a personal issue, so she gives her regards. And then we have Hibak Kalfan, who is the executive director of NEAR, which is a global South-led network of local and national civil society organizations, challenging top-down aid systems and reimagining community-centered ecosystems of care, response, and solidarity. She also was on our advisory committee, and we, particularly for the financing component, looked at NEAR and really appreciate a lot of what NEAR is doing in this area. So we're hopeful to learn from her. And then we have Dr. Cyril Ugarte, who's the Director of Health Emergencies at PAHO, and Cyril has extensive experience in disaster risk reduction, emergency preparedness. And again, I think following Judy's question, it's interesting to see and learn from him specifically in the Pan-American health area. And then finally, we have Dr. Valerie Bemo. Valerie is the Deputy Director of Emergency Response at the Gates Foundation. She's led global health emergency preparedness and relief efforts with experience across various crises and also in COVID-19. She also was on our advisory committee, and we've learned a tremendous amount from Valerie. So we're thrilled to have you all. And I'm going to jump right in with Hanin, looking at localization in Sudan's ERRs. So I think the Commission argues that power, resources, and decision-making should shift to affected communities and locally legitimate actors. I do want to note, we saw David's response when we were at ICFA in Geneva, which is a international NGO consortium. And it was interesting to see how the international and national NGOs went back and forth a little bit and certainly didn't agree in terms of power shifts. So we're going to hear a little bit more about how Sudan's ERRs are actually, what are the lessons learned from the ERRs? What is it about what genuine localization looks like in practice? What were some of the barriers preventing donors and international agencies supporting you in this model? And also how relevant do you think this could be as an example in other situations?
Good afternoon, everyone. Thank you so much. And good afternoon, everyone. Thanks for the Lancet committee to give us this opportunity again to amplify voices from the grassroots. So I will go straight to the answer. The Commission argues about that power, resources, the decision-making should shift to affected communities. Sudan Emergency Response Room, grassrooted mutual aid group, are held as an example. But here is what framing misses. The Emergency Response Room did not emerge from the localization policy. They emerged because the international system evacuated. Young people like me in Umdurman, Bahri, Al-Fashir, Kordofan had a choice: watch their neighborhoods die or organize. So we rose up. We organized WhatsApp group, became supply chain, mosque and church committees, become a trade center. Mutual aid kept bakeries open until we bumped. So the questions for this room, academics, future practitioners, international actors, is not whether the mutual aid groups model works, but what can we learn from them and why the system is still failing to support them or failing to support them. Lesson one, German localization is start with existing social trust, not importing structure. The Sudan Mutual Aid Group did not come from UN capacity building workshop. We grew up from neighborhood committee, youth networks, and mutual aid groups that already trusted each other. A single community leader with a phone could mobilize faster than any cluster system. Research implication, we need to stop measuring local capacity as something international actors built. We need to start measuring how we recognize the resources, what is already there. Lesson two, decision-making must sit where information lives, which is never in a humanitarian hub. ERRs and other mutual aid groups made a real decision about who gets the last bag of grain, how to negotiate at a checkpoint, which wanted child to evacuate, speed was their comparative advantage. Centralized system, no matter how well intentioned, cannot match that. Research implication, decentralization is not just a principle, it's a survival mechanism. Our funding and reporting system must match that speed. Lesson three, flexibility and trust are not risks. They are requirements. Sudan mutual aid groups and emergency response room operate with a WhatsApp, paper list, and volunteers. They did not speed complex log frames. Although we invented something called a system, you can read more about it in my comments, but at the end of the day, we're not going with the international thing. They need cash protection, not being asked to fill out 6 due diligence form. The system that work in a stable context activity harm crisis response. Research implication, we have over-engineered humanitarian accountability. The real accountability is to the people dying while forms circulate. So most of the international system is not scaling this model. Here, one, risk aberration, designed its fiduciary view. Emergency response from volunteer are detained, raped, and killed. But agencies say we cannot transfer cash because we cannot verify use. Meanwhile, people striving on the ground, the real risk is not financial, it's a moral. For researchers, this is a testable hypothesis. Compare outcome where flexible funding was allowed versus where it was not. The evidence is already exists. UN agencies and international NGOs are measured by how they spend and how many outputs they reported. They are not measured by how they are enable local actors, so they created parallel system instead of stepping back. For the students, this is a classic principle, agent problem. The agent international agencies, I'm so sorry for comments here, have different incentives than the principle affected people. Barrier 3, only 4.3% scandal, only 4.3% of pool funds are directly go to the local actors. ERF receives the most nothing directly, and other mutual aid group in Sudan. At least emergency response room, we have accessibility, but other colleagues, they don't have it. They survived diaspora on remittances and under table support. That is not the system failure, that is the design failure. Barrier 4, donor funding cycles lower than crisis. We need money in 72 hours, donor takes 6 months. The mismatch is fatal and internally flexible within a political will. For the professors, the researchers can measure the cost of delay, publish of evidence, make it undeniable. For students, you will enter a system that is broken in predictable ways. You do not have to replicate it. You can design differently. For the international actors, the question is not whether you trust local responder. The question is whether you're willing to give up the control. Sudan Emergency Response Room and other mutual aid groups are not waiting for permission. We are saving lives without international system that have shown, or we have shown, what genuine localization look like. The question for this room is not about Sudan, it's about the blueprint for every future disaster. We will learn from the grassroots mutual aid groups in Sudan, or we will keep writing reports about them while building the system in a broken system again. Thank you.
We should put this into a PhD thesis, I think. No, that was really wonderful. Thank you. I'm going to move to Jeremy. We talked about attacks on civilians and health workers and health facilities. They've become normalized, and Joanne Liu talked a lot on this. When we did the report, I think the hardest part was not everyone agreed that there is impunity and that we need to end impunity. The hard part is actually how, and we've been scoping and trying to deal with this. And I think from the what was suggested was it's not going to be clearly a magic bullet, and there are these big geopolitical issues. But looking from the communities, from the national all the way up to the international. But we'd love to hear from you what you're thinking, and then in particular this aspect of how to make it feasible. Give me the easy question.
Thanks so much, Paul. It's an incredibly important question. I think one of the most important issues that you raise in this really excellent commission report, and it's also, if it were easy to solve, I think we'd have solved it already. I do think. So maybe a few pieces that I think are really necessary. One is just we need to talk about this, and we need to bring the reality of what's happening out in the open more. And I think some of the data you showed in your summary at the top are really important, and I think not sufficiently well understood across let's call it the foreign affairs, national security space, certainly in this country, but I think globally we're not talking enough about attacks on healthcare. We need to be talking about this much more. The protection of healthcare and health workers and health facilities is one of the most fundamental parts of the Geneva Conventions. It is one of the fundamental origins of the whole concept that war has rules. If you go back to Solferino, what was Solferino? What was Henri Dunant talking about? He, in part was talking about the protection of the wounded in war. And this is what we're seeing particularly in the last decade, and I think in the conduct of the Israeli military in Gaza has gotten a lot of attention, and rightly. But I think we also need to look at Ukraine. We also need to look at Syria. The data that you showed that this is not something that suddenly became a problem after October 2023. This goes back years, and the spike that you show in that data goes back 2021, 2022. So this is a bigger problem. It's a global problem, and what I think we see with that consistent erosion of the protection of healthcare workers is this is not a problem of any one side or any one crisis. It is something that now many countries are involved in, and no countries are acknowledging or frankly feeling much shame about anymore, including the conduct of the US and the Iran war. And we've seen what that looks like. We've seen what it looks like when you don't have these rules. it looks a lot like the world before the Geneva Conventions. The rules were written in response to something. They were written in response to the kinds of behaviors that we're now seeing normalized once again, that were stigmatized and are now again being normalized. And so I think it starts with talking about that. It starts with stigmatizing that again. And I think, how do we do that? I think we do need states to speak up. The fact that the US, and frankly, kind of regardless of party, the fact that the US has not spoken up on this in a consistent way. They will condemn it, the US will condemn what Russia does in Ukraine, but will be much more muted, was much more muted about what the Saudis did in Yemen in 2015, even more muted about what the Israeli military has done in Gaza, and is doing in the West Bank, and in Lebanon, and in Iran. That just sends a signal that adherence to the rules of law, or to the law of war, is conditional. That it depends on which side you're on, not which rules you follow. And that is effectively the destruction of the laws of war. So we need countries to call out not just their adversaries, but also their own, and also hold themselves to this. If we don't have that, we can't get anywhere. And that, frankly, that's an issue of politics. And it's also an issue of what we as citizens of some of those countries are willing to accept. Are we willing to accept that from our governments? I don't think we should be. I really like Joanne's idea from the last panel about operationalizing IHL. I think we need to, what we also see over this last decade is some real gaps in how IHL is understood and applied when it comes to the protection of healthcare. And when the best, and I love the ICRC very much, but when the best that the ICRC can do in the face of assaults on health facilities is just restate the conditions under which health facilities can be lawfully attacked, as opposed to saying, no, that was not a lawful attack, then what happens in practice is that international humanitarian law does not become a restraint, it becomes a how-to manual. As long as you can find a lawyer, as long as your military lawyers can spin some fig leaf rationale for what you've done, you can find a way to justify those attacks, and the international community will let you get away with it. And I think we either need ICRC to be much more forward-leaning on that, which I don't think can expect, because it's not really the role or the DNA of ICRC, or we need a conversation about some new rules and some new standards for how IHL is applied and how it is assessed. Right now, there is no referee saying whether an assault on a hospital is lawful or justified. And in lieu of that, governments are quite happy to claim it is justified and it is lawful and move on and destroy the next hospital. So there's a gap there, certainly in the practice and arguably also in the text of international humanitarian law when it comes to the protection of health facilities. But let's just say, again, this all comes back to state behavior and states being willing to uphold international humanitarian law. States did not come out of World War II saying that was a great way to fight a war, let's keep doing it that way. States came out of World War II saying we must never do this again. And they wrote the Geneva Convention and they wrote the Refugee Convention and other international instruments that really are a legacy of those who suffered and survived World War II, as a warning to our generation and future generations not to do this again. And we are losing that warning and doing it again.
I'll just a quick follow-up is how at Refugees International, how you're dealing with advocacy, but we've spoken about this, but I'd like to hear a little bit more about, and it came up, how can you advocate and go beyond the usual suspects? What are you trying to do in this area and others to reach other people, largely people who are not in this room, because I imagine most people in this room also would be agreeing with you.
It is a challenge in a unique, somewhat unique dynamic on displacement advocacy generally that, the U.S. government is in almost an adversarial posture towards most of the things that we hold dear. And so we have broadened our targets. We're engaging more with We're going to do much more with refugee hosting countries directly. We're finding there's a lot of appetite for that. We can't do bank shot advocacy through the State Department anymore, trying to urge the State Department to urge the government of such and such country to do such and such thing, because frankly, they don't care, or may want to do the opposite. But we're finding good receptivity from many of those governments. We are trying to, where there are governments that still have an interest in upholding international humanitarian law, we're trying to work and partner with them. We recently, I was in New York a couple of weeks ago, along with my colleagues, my peers from Save the Children, Oxfam, and a doctor who had just rotated out of Gaza, and doing a press conference to counter-program what we were hearing from the Board of Peace. So the head of the I forget the exact title, High Representative, I think, of the Board of Peace, Nikolai Molinov, was briefing the Security Council that day, and frankly, it was kind of a whitewash. And if you were to read the Board of Peace reporting on humanitarian conditions in Gaza, you would think things were generally going pretty well, and that to the extent they weren't going well, the only obstacle was Hamas blockage of aid. And you would have no understanding that the Israeli government continues to systematically obstruct humanitarian aid in Gaza. We need to speak truth. And so we went out to the UN, and in the Secretariat building, we briefed about 30 or 40 journalists to try and get the reality out there. We provided talking points to the member states who were going to be questioning Molinov after that briefing. Many of them took those up. I do think we need to continue to use the mechanisms we have to hold these systems accountable and keep speaking truth and keep speaking out. And one of the things that we are seeing right now on this and other issues is, while we're not necessarily seeing what we need out of global politics, I think global people around the world, people in the US do want that truth. They want to see it, and that will eventually find its way back into politics, as long as we can keep speaking the truth in the meantime.
Thank you, Jeremy. So Hibak, I've had the opportunity to speak with you and learn a little bit more about NEAR, the NEAR network. And so the commission has set up calls for a fundamental shift, and one of them is financing towards locally legitimate actors and affected communities. And the NEAR network has similarly championed locally led humanitarian action and more direct access to funding. So first, maybe you can talk a little bit about what you are doing, but also in particular, what are the changes that you believe are needed in humanitarian financing architecture to make this happen, number one. And the second component is, how do you see what NEAR network is doing that could be scaled up, let's say, into other settings, or do you anticipate it's going to be locally and there'll be numerous different types of networks like this?
Thanks, Paul. Hi, everybody. Before I actually go into that, there's something that I think is really important to say, which is we're involved in a horrific perfect storm when it comes to the financial architecture of the world, not just the humanitarian sector. When many African countries are paying more of their money towards debt servicing than they are to their health and education systems, that's a first shock. When we think then an emergency happens or a conflict happens or we know that climate disasters are happening, that's another shock. And then we have, to be very frank, a humanitarian system where I disagree with David Miliband, and I was hoping he was going to be here because it is a zero-sum game, because some actors need to lose the resources in order for others to gain them. So that is the unfortunate perfect storm that we're involved in. And then 2025 happens, and the US government decides to pull a huge amount of humanitarian resources from the global system. And we're still now even fighting for that limited amount, which is really, really hard to see with things like Ebola happening right now, with Sudan and the lack of response to the ERRs, with Syria, with Somalia, with so many other countries. And so I think we need to also step back. That the how is important, but we're involved in one of the most difficult times, I think, in the last 100 years. So For us, to Dr. Ibrahim's comment, she talked a lot about the possibilities, and I think that's what we were talking about, Paul, while you guys were putting this report, this wonderful report together. We've been working on at the NEAR Network. We are a network of 369 local and national organizations across 45 countries. And we work with 22 national and local networks, which give us access to almost 10,000 local and national organizations. Since our inception in 2016, the 25% localization marker came out. And so we spent 26 to 2019 advocating why funding should go to local actors, and talking doesn't help much. So in 2019, we decided we were actually going to build or support the ecosystems that exist. So in 2019, we developed an innovative financing strategy, and it basically said, put the money closer to the communities, build infrastructure or support infrastructure that are closer to the communities. And that intermediaries cost a lot of money. I heard from the executive director of the International NGO, just to get to the actual programming, it took 8 layers of financing to actually get to that point. So I find that to be very similar in many, many institutions. So what we did was we basically did a bit of a mapping to see where local and national funds existed at that time. We spoke to indigenous funds, activist funds, humanitarian funds, climate funds, and kind of said, we hear constantly from donors that you don't exist, that they haven't been able to identify you. You do exist, so how do we think through amplification? Then we did a bit of testing where we supported the building of a fund in Somalia. We supported building a fund in Nepal, but the local actors built it. The local kind of ecosystems built it. And then in 2022, we were challenged by a foundation, and that foundation said, would you consider actually building out a fund, a pooled fund for local and national organizations in humanitarian crises? And we did. We built something called the Change Fund. And since then, we've been able to kind of test it out in a controlled environment where what was said today multiple times, decision-making is the key. We're now doing a review of that. It's who makes the decision determines how effective it is and how efficient it is. And so we have 9 people on the oversight body who have lived experience across 7 countries who basically say, once an emergency is declared, they declare it through a criteria that they determine. Once that's declared, then our members who are pre-approved have 72 hours to apply. Then it's a 2-page application. You say what you need to do in your community. You say how much money you need. It's between $150,000 to $250,000. And then you come back to us with a 1 or 2-page document that says this is what we did. It's trust-based kind of resourcing. And we have done that. We've now given 65 grants across 25 countries, and 470,000 people have been served by it. It's not a ton of money. It's $6.5 million so far. But donors are finally listening because they needed a proof of concept. We've built a proof of concept. And so that's a way where there's an opportunity for scaling. Another is we took the conversations we had from 2019 until now, and we did a mapping, a 6-month mapping recently, and found 63 locally led pooled funds. Locally led pooled funds is a new buzzword, just like localization was. We have found that some donors have funded international intermediaries because the title said locally led pooled fund. But we're getting to a point where we're trying to support them, think what interoperability looks like. Jeremy and I had conversations about this last year, thinking about what resourcing looks like. In each one of those funds, they weren't created in the last 5 or 10 years. They were created 20 years ago. And they were created to service their communities. They were created because of the needs of their communities. And when we talk about cost efficiency and cost effectiveness, when we look at the percentages of how much goes towards kind of operational costs versus towards the community, it's really clear. The numbers are very, very clear. So I appreciated what people have said also about political will. We really do need political will. We're now seeing more and more donors changing the way they talk, but the checks are not changing. The last thing I wanted to say was around instruments. Instruments are really, really important. Not instruments of receiving the aid, but the instruments of how the aid goes out. There are projectized funds with bilateral donors, and there are contributions. More and more local actors need those contributions and less projectized aid, because that's when we're talking about flexibility, that's when we're talking about multi-year, that's when we're talking about program type of funding with some donors. So the more and more we can move towards that, I think the more and more we'll see local actors being able to absorb the resources, not just the risk, but also be able to program them. And then we're not having an apples and oranges conversation of what the UN is doing versus what the local actor is doing, but we're having an apple and apple conversation of who's most effective and who's most efficient.
So just briefly, because I know you said the same aspect of how do you convince donors that, to change the system? Because you're talking, you said, I think 150,000 or so. How do you go into the hundreds of millions of dollars, and what, given the system, the accountability that the donors require, how do you see that changing so that you move from 6.5 million to 200, 500 million?
So I just got back from a 3.5-week trip to Europe last night. And it's the people. Now there are people in the director roles in a lot of these bilateral donors who actually believe that this change is possible. And they are open to scale funds like the Change Fund, scale opportunities like the ERRs, scale different funds. It's that instrument that I was talking about that needs to change. The moment we get them to write the checks that are contributions, like they're writing it to multilaterals, that's when we'll see scale. But if we continue with this projectized granting of $1 million over 3 months and you have to follow all of these things, we're not going to get anywhere.
Thank you. Cyril, as Director of Health Emergencies in PAHO, you've led an incredible number of responses. The convention argues that humanitarian responses should focus not only on service delivery, but on protecting and strengthening health systems. And Chiara had mentioned that right now, a lot of the reporting is not on actual systems, but individual pieces. So from your experience, what would it take to place health and health systems at the center of humanitarian action, particularly in some of the protracted crises? And what have you learned from PAHO's work in this area?
Thank you, Paul. Hello?
Yes.
I think the question should be, are we putting the people at the center? Because in my opinion, I was the Director General of National Defense at the Ministry of Health of Peru for 11 years during internal conflict and many emergencies, including cholera, big economic crisis, and so on. And when we put the health sector and health systems at the center, it was seen as I was defending my job, my area. It was, on the defensive with the Ministry of Economy, but also with the President. When we said, no, it is not us. It is the people's health and well-being. That makes a huge difference. And when we translate that into economy, well-being, social aspects, socioeconomic impact of the health of the people, then we made the change. We faced many emergencies, as I said, cholera, but also many other emergencies. And when we translate that into socio-economic impact, then some lights were turning on. And we began receiving some funding. Some funding localized at that. And when I joined PAHO, I would say PAHO is the center. PAHO, well, by the way, the Pan American Health Organization was established in 1902, so almost 50 years before WHO, and now PAHO serves as the regional office of WHO. And they were saying, we even the DG said, we need to defend WHO, our PAHO. I said, no. Not even the ministries of health, not the health, it is the people's health. So I would like to emphasize that, because if not, we will go into a system. And we will continue saying, for example, health for all in the year 2000. Well, The year 2000 was very bad, isn't it? But we are still repackaging that in something that is, is heterogeneous. Primary health care is not the first level of care. And the priority held at every level of the system. Many people in most of the poor countries do not go to the health post or the health center because they don't solve the problems. They go to the hospital or the provincial health center. So we need to focus on that, on the health of the people first. The second thing is we need to work on visibility, transparency, timeliness, and also accountability. And when we say those words, is it the local system? Is it NGOs? Is it donors? It is mostly governments, ones that are in charge, who are the first and ultimate responsible for the health and well-being of the people. And when we try to move that needle, say, okay, you're accountable, but you don't make the decisions. Somebody else will take the decisions. Come on. You're taking out the responsibility. The authority must come with responsibility, and we must make accountable, but without moving the decision-making outside of them, because they were the elected officials, and they are responsible for providing that. And I think that's a big shift that I don't see very clear moving on. And that will come with coordination, with donors, with local systems, with social networks and so on. But when we work with, for example, in large emergencies like Haiti, more than 2,500 donors that went to Haiti. All of them went back to their premises as heroes. But who has the Haitians? Almost nobody. So the thing is that we are moving those things outside of that equation, and coordination is a very nice word. Everybody wants to coordinate, but nobody wants to be coordinated. So how can we do that? Translate that into action, into something that we change the not only the narrative, but also the equation, and how can we measure that? And I think in that regard, there are many examples. In the Americas, the first regional policy of humanitarian assistance was approved in '89. The regional response team that was deployed to all big emergencies around the world was established in '92 in the Caribbean by the small islands that couldn't support their own emergency, so they had to work together. And now we have the Global Health Emergency Corps. And then after the COVID-19, the emergencies, and so we say, okay, there is a Global Health Emergency workforce. And then the word emergency was dropped. And it's health workforce. What? And then we say resilient health services. And the word resilient doesn't mean nothing. So we need to put things in perspective. And I think if we are serious about this, we must have the people that are in charge accountable for that. We cannot drop the ball on that. At the same time, when we discuss with those people, with presidents, I do that. With presidents, with ministers of health, I talk to them in private. These are the issues. I don't go to the press. And I hold them accountable. And many of the ministers of health cry in front of me. Because they are humans. They are humans. They are, they have to do, but they cannot do that. Because of political reasons, of economic reasons, of social situations, etc. So I think migrants in Venezuela, because of those talks that we had, was controlled in 5 months. In 5 months. Brazil took 4 years to control them. But because we spoke directly to the president, to the minister of health, that didn't want to acknowledge that they had missiles, because all the Venezuelan migrants were being treated back in other countries because they were spreading missiles. And it happens now in all emergencies. So I think we should move that needle like that and concentrate in the health and well-being of the people at the center. Thank you.
Very good. Thank you very much.
We'll move on because of time to Valerie. So Valerie, you've had a lot of experience in the field, and now you've been at Gates Foundation for a while, and you've seen both the potential and the limitations of global financing mechanisms. And the Convention argues that humanitarian financing is too often driven by politics and visibility rather than need. What reforms do you feel are both necessary but also realistically achievable? It's a bit like with the end impunity. It's easier to make recommendations than actually seeing what's feasible, particularly in this geopolitical climate. And how do you think, we've heard from our colleagues about how donors can actually support local actors in strengthening national systems and getting away perhaps from putting everything through international actors? What's feasible?
Thank you. It's actually difficult to come after these passionate people before me. And I know all of them, most of them actually. I think there's different way to look at the situation. There's money, yes. There's a lot of top of money, but there's still a lot of money. I think the question is like, how do we use the money? I think that's, for me, is the big piece. Where is that money going? You can look at the curve of the money. Where's that money going? You saw the slide that you presented. It's still 4.3 going to the local. That means that even with the drop didn't affect actually the people themselves. If you go to a lot of community, currently, like I said to people, we don't see people dying on the street because the cut, yes, there's a lot of issues, but actually most of the people, they're paying from their pockets. They're struggling, they're paying for maybe some diaspora, but we have to look again at our system we can do the big block of funding, but I think the accountability, I like the accountability, but it's like, what does it mean really? Then in terms of finance, there's two blocks here. You have one country have legitimate authority. I think that is where we start. I agree with the CEO that by country expecting somebody else to put the money to solve their issue, you are giving your power. I'm sorry, that is reality. You cannot expect why somebody else country love your people more than yourself. This is reality. If I'm in the household and somebody come every day to feed my kids, then they start having the control of my house, and I can't complain to them too much. And there's a proverb Africa that said that when you have somebody boat, you have to sing his song. That means that you can't sing your own song because they'll put you in the water. And I think that is where we have to start. But even more than that, we are not recognizing what people put every day in their own head. We are not accounting that. We are counting the big money, but I'm sure if we start looking at what people invest themselves in the day-to-day, this should be the starting point. I should be saying, then the country themselves, government have to take on to say, yes, we are willing, because health is a right, actually. And then the donors, I think I've been discussing with a lot of Ministry of Health, and they're like, I don't like this is not right for my country, but I don't have a choice. I said, what do you mean you don't have a choice? You're Ministry of Health. It's like, yes, but if I talk too hard, then they go to the Prime Minister, or they go to the other people, and then we'll lose all the money. And then I better say what they want so that I get a little bit. I say, but how good is that little bit if you know it's not good for your people? What is the point? And I think I just want to say, yes, it's so easy to put in international, big country, that is good. The solidarity is important, but the solidarity should not hold for us to take our responsibility as an individual, as a community, as a country. And I think I want to put that because if we have to shift, I like the invert the power, but invert the power comes with responsibility as well. Invert the power, and I see Hibak here. There's a lot of local organizations who say we are local, we're doing this, but they actually copying what they've learned for the international. They go and do the similar thing because that is how they have been trained. That is what they've seen all their life to do. Then we need to invert it. We need to push a little bit differently. Also, we need to start as a health people that a lot of us are here or humanitarian. I think we have to change even how we talk about it. Usually we go and say people are dying. You know, for a politician, yes, it's not their, yes, they're caring about it, but maybe we have to, I like the idea of cost effectiveness that somebody mentioned. I like the idea of like, we need to put, and I think that is what Ciro said, it's like we need to put data differently. How your economy, how your country will be impacted because you don't have the measure, because the measure spread, then the government will move. But we tend to go with our words, our technical words, but doesn't touch. What will make you elected again? What it is. And I like the idea of the social will that was mentioned early, because as citizens, what are we doing? How do we wake up ourselves? Because if we still continue electing the same people, it's on all of us. It's not on the people elected, it's us. All of us are part of the issue. And I think I'm trying to bring because it's a difficult issues we are facing. There's less and less money. And they will not be better. We see the change in the world and the running after arms for most of the country now, European, all the donors, they are cutting the money. The money is there, but they are reducing it to put in arms and things. It will not change. It takes 4 or 5 years before these arms are effective. That means that the next 4 or 5 years will not see change in terms of financing of the money. And when you have arms, you have to use them. Then, unfortunately, we may see even more crises. And I think maybe in the way we look at the accountability and the numbers, when we look at Ebola outbreak now in DRC, the first people who die or who are in the field, it's not us. It was a nurse who were doing this duty in the middle of nowhere. It's the health workers. It's the caring families. Then how do we even making the counting or making what is their contribution? That may not be a lot of dollars, but a lot of will, wanted, and community. And the last one I want to say is that I think the way we are counting also is in dollars, and we are changing we are actually pushing a way of seeing the world that is Western and capitalism. All our data is about money, but we don't account on the community health, social capital, physical capital that are there. I think we will need to change the way we see the world, the lens in which we all have been in that Kool-Aid, including me. We have been feeding in that, and I'm still doing that. We're still doing it. We still, as donors, as humanitarian, we went with the saving life. I'm saving their life. Seriously, are we really saving their life? We are not in control. They are alive, they save themselves, and we come and support them. Let us start changing that paradigm, because I think that would be the change of the financing. Then we'll start looking at it differently to say, actually, people put more money in their head, and it will make us feel bad as well, because it's like, oh, I thought I was putting so much money, but if you account what people put themselves, it's bigger than what we put. And the other piece, we are in the serious issues financially, and we need to stop also funding just on the short-term relief. We need to start putting on the system. And I'm just taking an example again, Ebola, when it's happening, if we have put more emphasis on surveillance, active surveillance, we will have detected cases early. If we have a bit more lab, if we have all these issues, we will not have been where we are. Unfortunately, also, a lot of people is about the visibility. When we have the antivirus, it was like big, everybody crazy. Ebola is like, it's not so much, because who are the people affected? Are the people poor in DRC? And antivirus are people go to resort and go to cruise ship. Maybe we have to change our dynamic and paradigm as well.
Thank you, Valerie. Because of time, we're at 1:30. I'm going to end, and we will, sadly, and it's very poor on my side, poor moderating. I will not open any questions. I just want to end, firstly, to thank the panel. So we can do and with these commissions, and Richard and Anna, we do have a plan for a post-commission. We still have the launches, but just as the broad strokes, we hope to develop a global humanitarian alliance where it will not be just academics. So how to operationalize this will be to work with a mixture of diplomats, a mixture of humanitarians, NGOs, UN. We need to include the people that are actually going to be
actors
making these decisions. Which one?
Local actors. You said important one. You forget us now.
Don't forget. No, I mean, local actors, one of our issues is, and where we've struggled with, and I think this is one, maybe Hibak mentioned it, is that when you talk about local actors, how do we get local actors that are representative globally? It's one of the challenges. And I think one of the ways to do it is through these various alliances that we're talking about in the countries. But in fact, it's before local actors, it's the affected populations, and it's the same issue. So one of the ways we also do that is through working with people with lived experiences. We often find that the local actors or the people with lived experience become the same people over and over representing. And so it's something we need to work on. It needs to develop a global humanitarian alliance. Some of that likely would be a global humanitarian or health protection alliance that's already being worked on by Len Rubenstein and others. And I also would like to develop an observatory where we can, through the Lancet, we need to work on what would be some of the key indicators that we're talking about, more the systems and the financial and cost effectiveness level, but to actually do some reporting and try to have more accountability, something on the lines that was developed on climate change early on with Countdown 2030. So those are our broad plans. We're going to be working on that after the launches, so really starting in June or July. And we hope that you all will become involved and support us in this area as we move forward. So I'm going to stop and say thank you again for coming. We do have it's very, very nice up on the 9th floor. We have a reception where it's outside. It's a beautiful day. And so please join us there, and I hope to see you all. Thank you.